What is considered a sleep apnea event? If you've ever woken up feeling tired despite a full night's sleep, or if you've been told you snore loudly, you might be wondering what exactly happens during a sleep apnea event. Let's break it down to understand this better. Sleep apnea is a condition where your breathing is interrupted while you sleep. There are two main types of sleep apnea: obstructive sleep apnea, OSA, and central sleep apnea, CSA, but we'll focus on the more common one, OSA. In obstructive sleep apnea, the muscles in the back of your throat relax during sleep. This relaxation causes your airway to narrow or even close, cutting off your airflow. When this happens, it's called an apnea event. Here's what typically occurs during an apnea event. Your airway is blocked, and you stop breathing for at least 10 seconds. This can happen multiple times throughout the night, sometimes up to 30 times or more per hour. Each time this happens, your brain senses that you're not getting enough oxygen and briefly wakes you up to reopen your airway. You might snort, choke, or gasp for air, but often you won't remember these brief awakenings. Another type of event is called hypopnea. This is when your breathing is reduced but not completely stopped. During hypopnea, your airflow is decreased by at least 30%, and this also lasts for at least 10 seconds. Like apnea, hypopnea can also lead to a brief awakening. To measure the severity of sleep apnea, doctors use something called the apnea-hypopnea index, AHI. This index counts the average number of apnea and hypopnea events you have per hour of sleep. If your AHI is less than 5, it's considered normal. However, if it's between 5 and 15, you have mild sleep apnea. Between 15 and 30, it's moderate, and greater than 30, it's severe. These events can significantly affect your sleep quality, making you feel tired, sleepy during the day, and even irritable. So, if you're experiencing these symptoms, it's a good idea to talk to your healthcare provider to get a proper diagnosis and treatment plan. Understanding what happens during a sleep apnea event can help you take the first steps towards better sleep and overall health.